Welcome to the next episode of Your Better Health with Dr. Garaj Bansal, a scientist, an engineer, and a medical doctor from Columbus, Ohio. Dr. Bansal is a board-certified diagnostic and internal medicine specialist. He's a graduate of The Ohio State University Medical School, where he received his MD, and also Case Western Reserve University, where he attained his PhD. Dr. Bansal has served the Central Ohio community as a health and wellness expert for over 40 years. He has been the medical director of 3 addiction clinics and is currently the medical director of 3 urgent care facilities in Central Ohio. Dr. Bansal believes in an analytical, scientific, and holistic approach to individualized health. This incorporates both physical and mental health while keeping the needs of the soul and the spirit in mind. Today, we're going to talk about 2 subjects, depression and anxiety. Dr. Bansal, when we use the word depression, it is often misunderstood. What does it mean medically?
Well, the depression, the clinical depression, that's what we are going to talk about the most. I mean, that gives you the feeling of helplessness. That's something that you're constantly worrying about the past, the brooding over the past and bringing the negativity from the past to the present. And that makes you very miserable. Now, let me just start by saying first that one of the challenges in addressing depression and anxiety is the stigma that surrounds mental health issues. It actually deters individuals from seeking help, and then it perpetuates a vicious cycle of suffering in silence. Now, what I want to say is that if you're suffering from depression, you are not alone. There are hundreds of people who we know, including Bill Gates, including Richard Branson, who is the owner of the Virgin Airlines, Jim Carrey, Richard Dreyfuss, tennis players, Phelps, who's a swimmer. They all have had depression in their lives, and including me. I have suffered with depression and anxiety all my life. So I understand your pain, and I can see where you are coming from. The spiritual leaders or psychologists, most of them have not had a first-hand experience. They learn from their patients or from the books or from the reading. So here I am giving you the lifetime experiences of my life. How much does the depression hurts so that I can help you better, with the hope that you lived better than I did.
First thing that you said that I want to address is, why is there such a stigma around the issue of mental health? We don't have a stigma around physical health. When we have allergies, we don't have that stigma. If we get a cold, we don't have that stigma. Why is mental health so different?
Well, I don't know. I mean, the people, when they have their physical problems, they openly talk about it. If they have a cancer or they have any kind of problems, they talk about it. But somehow the stigma may be coming from, their work environment or the society or the social issues. But there is definitely a stigma while talking about the depression and anxiety.
What would you recommend we as a society do to overcome that stigma so that people aren't ashamed of their depressive condition?
Well, the thing is that we should take mental diseases very similar to the physical diseases that people can call sick. Well, my stomach is hurting and I don't feel well. But if they call and say, I don't feel well mentally, it is looked down upon it. So that has to be taken care of. People with mental diseases, they should be allowed to take a week or 10 days off, because sometimes it takes that much time to recover them from depression and anxiety.
Do you think that part of the problem is that the employer or the general public doesn't understand depression? Because a lot of times in my lifetime, I've used the word depressed and people have said, oh, well, you just have the blues, you'll get over it. That's not what depression is. It's not a temporary feeling of sadness.
Yeah, there is a difference because everybody has mood swings on a daily basis. You come to work and then you have an argument with your boss, then your mood swings. You go home and fight with your spouse or argument, you have mood disorders. These are temporary mood disorders. There is no biochemical imbalance in your brain. We are talking about the depression which interferes with your daily life, and you feel helpless. Sometimes you feel suicidal. I'm talking about that clinical depression.
What are some of the signs that people should pay attention to so that they understand the difference between what you call mood swings and the chemical depression? What are some signs to look for?
Well, chemical depression is prolonged, that you have had this depression for about 3 to 6 months, and then you feel very helpless. And of course, you have somatic symptoms like fatigue, not able to work, not willing to work. Whatever you used to enjoy in the past, you don't enjoy those things now. So those are the signs of clinical depression. It's actually interfering with your daily life. When people are depressed, they go into the financial ruins, and they also damage their relationships with their loved ones. But that doesn't happen on a day-to-day basis like a short-term depression or mood swings.
So if I notice, or say my spouse or a family member or a friend notices that over the course of a period of 90 days to 6 months, there have been these changes in my behavior, what do I do? Where do I go for help?
Well, it's very similar to what I talked in the past, that these mental diseases have both the organic or biological component as well as the cognitive component. So the first thing I would say is go to your family physician, discuss your symptoms, and find out if there is any organic disease, that is the lack of transmitters or lack of hormones in your body which are causing your depression. If that is not the case, then he may start you based on your symptoms on an antidepressant. Now, I will come back to the anxiety later on, but as I said, that the medicines in such, they take care of your somatic symptoms. They will help you in getting a good night's sleep so that when you get up, you are fresh, you are focused. But when it comes to the feeling of helplessness, that does not go away with the medicines. So for that, you need to have a CBT, which is called the cognitive behavior therapy, or talk therapy from a psychologist or a psychiatrist.
What is the difference between a psychologist and a psychiatrist?
Well, the psychologist and psychiatrist, they can both do the cognitive therapy as well as the talk therapy, but psychologists cannot prescribe the medicines. On the other hand, the psychiatrist can prescribe the medicines. So if you see the psychologist first, and then he or she thinks that you need the medicine, then you have to come to the attention of your family physician to get the medicine. So for example, psychiatrist is both a psychologist plus the family physician for that illness, but psychologist only can do the cognitive therapy and talk therapy.
Over the years, there have been many platforms of different psychologists and psychiatrists. One of the most famous, obviously, is Dr. Sigmund Freud. Over the years, how have psychologists and psychiatrists evolved in their treatment? What has changed in our lifetime?
Okay, this is a very interesting question. Sigmund Freud, almost 100 years ago, coined a term neurosis. And now we don't use the word neurosis, or we don't say you are neurotic. We are using word psychosis, psychotic, personality disorders, and all that. So when he came up for the treatment of this neurosis, he said the psychotherapy is good, but it's not the answer. And he actually used the word organic. Okay, he said there is more to these diseases than just the cognitive thinking. But now in 100 years, we have neurotransmitters, we have antidepressant, we have anti-anxiety medicines, we have neuroimaging, we have neuroscience. So we have come a long way since Sigmund Freud.
When someone goes to talk therapy, what is the difference between talk therapy and cognitive behavioral therapy, or CBT?
Okay, they are very similar. And so I don't do CBTs and in my practice. So I would defer that question to the psychiatrist and psychologist, or I can bring it up in the next podcast. But talk therapy and CBT is, as you said, C means cognition. So that deals with the cognition part. So, I'm just like for the depression, there are two components. One is the organic component and one is the cognitive component. So the medicines do not take care of the cognitive part. And that's where the talk therapy comes in the picture. And they try to go in your past and then bring out, like, depression is actually a subconscious state. We talked about conscious state. We talked about unconscious state in psychosomatic diseases. To me, the depression is a subconscious state where you retrieve only part of your consciousness, that's the awareness in the present. And there is a bias for the negativity. So you only retrieve the negative part from your past. So the talk therapy and CBT does is they go into the subconscious mind and try to change that mind. And change that your thinking, and most of the time, the brain accommodates that by neuroplasticity, as we talked about.
So if I have the potential to have a negative and a positive childhood memory, cognitive behavioral therapy will try to help me focus more on the positive than the negative.
I agree with you, and I'm very much in favor of getting the cognitive therapy in combination with the medicines.
So where does the term seasonal affective disorder play when we're talking about depression?
Okay, the seasonal, there was an interesting article in my hometown, Columbus Dispatch, about 2 days ago, and they talk about the seasonal depression, which is like it may last you for 2 to 3 months. Okay. And this is especially at this time in Columbus, Ohio, when the days are very short and the nights are long, people generally get depressed. And one of the reasons they were saying that it causes changes in the serotonin, which is a mood stabilizer, or the melatonin is secreted more because of the too many hours in the dark. So these things, again, I'm not talking about seasonal depression. I'm talking about chronic depression, which lasts year long. And some people, as I said, I have suffered from depression almost 50 years. So this is, the one I have, and the other people I quoted, they don't have seasonal depression. Seasonal depression usually very rarely leads to suicides and all that. People have other options. They can go to, Florida, or they can go to some sunshine states and get over with it. So that's what my feeling about seasonal depression is.
When a patient is prescribed medicine, how long will that patient be on the medicine? Or is it something that they're on the medicine for the rest of their lives?
Well, it all depends with what kind of depression you have. You have to understand that the DSM-5 has classified depression as a major depressive disorder. That's only one kind of diagnosis. But there are other diagnoses like bipolar, the narcissism, the ADHD. They all can cause a similar depression, same kind of symptoms. So depending on what you have, so if you have a major depression, and most of the time you will be lifetime unless you divert your attention to holistic medicine, the spiritual medicine, and see how effective that is. And then again, as I said, in ADHD, the scientists have come up with the idea that the cerebellum sends the signal from the cerebellum to the precortex to make more dopamine and norepinephrine. So if you can enlarge your cerebellum by, the balance exercises, they claim that you can come out of these medicines.
But so it has to be slowly and over time, correct? It's not, these medicines are not something that you can just stop taking.
That is true. And then one of the concerns I have is when the psychologist or psychiatrist make a wrong diagnosis. Okay, let's say a patient has ADHD, but they put him on, the serotonin SSRIs or the medicines which most of the public knows, like Prozac or Effexor. Those medicine, if they are not monitored properly, they can throw the patient into the manic episode, and that is very dangerous. So the main thing is the diagnosis has to be done right. And I can give you an example. I saw a 19-year-old gentleman. He comes to me and he has been depressed and suicidal since he was 11 years old. He has been tried on all the antidepressants. And when he turned 18, he was transferred to the community psychiatrist. And then he looked at the chart and said, "Oh, you got bipolar." So they started putting on all the medicine, which she had a side effects. She was vomiting and abdominal pain. I mean, he came in to me, and then after 2 hours of history taking with the mother and him, found out that the patient probably has resistant depression from all these medicines. And I diagnosed ADHD, and I put him on 5 milligram of Adderall to be increased after a week to 10. After 2 weeks, he was totally new person. And he wrote to me that, "Dr. Bansal, I have never been happier in my life." So can you imagine, this person went through wrong diagnosis since age 11, very suicidal, depressed. And so the diagnosis has to be made correctly.
How often are these diagnoses incorrect?
Well, I cannot answer this, but lately I have been getting patients from social workers, psychologists to make the diagnosis, to make a right diagnosis. And I would say, I can't answer how much in my personal case, I went to several psychiatrists and psychologists, and none of them made a diagnosis for me. Okay, so I can tell you, I probably saw 6 psychiatrists, 3 psychologists, 1 social worker. They put me on antidepressant, bipolar medicine, nothing worked. It's only about 4 years ago, when I read all those things, and I said, I don't have either of these. So I took control of my life, and I have never been happier, more focused, and productive. So all I can tell you from my personal experience.
So we've talked about depression, and we've talked about its relation to the subconscious mind and our past. Now let's switch topics and talk about anxiety. And you said that a lot of anxiety is stress about the future. What did you mean by that?
Well, anticipation that something will go wrong. And they kind of imagine things worse than what is going to happen. And they also have some idea about, they also get involved with the present, that there is something not going right in the present. So the anxiety is both present as well as the future.
So
now
when you talk about that, what are some examples of people that are suffering from debilitating anxiety? Because everybody feels anxious at some point in time or another.
Yes. So I will lump anxiety, anger, and thinking into an arousal states. So what happens is that there is an inverted U curve where on the left hand side the arousal state is minimal, and on the right side it is on the other extreme that is very high. So at both those points, that is when you have arousal state very low or very high, your performance is very low. So there has to be some optimal value of the anxiety, depression, and thinking. And that is called the threshold state. So when you talk about the low end, that anxiety is normal. For example, I had to come for this podcast this morning. I never get up at 4 o'clock, but I got up at 4 o'clock. I rehearsed my podcast. I took my shower. I'm always wondering what the traffic would be, whether my car will start. So those are normal anxieties. Okay. On the other extreme, when you worry too much, anxiety is really more of worry, which is the means is that somebody is strangling you or somebody is choking you. That's what the anxiety is, and that's what it differentiates from depression. Okay, depression is more like the hopelessness. So the anxiety, so there are two components to the anxiety, the same thing, the functional as well as the organic. So the other symptoms of anxieties are very similar to depression, that you have lethargy, you have insomnia, sometimes, you're not focused, you have irritable, but the most important thing is the worriness, that feeling of uneasiness, the strangulation and choking. So what these medicines do, and I analyzed that for example, when you use benzodiazepines like Xanax, Ativan, or clonazepam, they only take care of your somatic symptoms. Like they will help you sleep, and then when you sleep better, you focus better, you're less irritable. But these medicines don't do anything for when you are severely anxious. So the irritability and the worriness actually comes from the cognition. So you have to use the cognitive behavioral therapy and side by side. And there are patients, they come in, oh, doc, I'm on this medicine, but I still have those, feelings of strangling or helplessness or not feeling much at ease. Then I said, you got to go for talk therapy and CBT, because they have to be used in combination.
Is it possible to have anxiety and depression at the same time?
Of course, yeah. The thing is, the biochemical pathways are very similar. Okay. Now, 60% of the people, they have both anxiety and depression. And it comes, I can go into the biology of these. They are controlled by the hippocampus, they're controlled by the amygdala. These are the organs in the brain. And amygdala is the main one, which is an organ for emotions, especially anxiety and fear. And then that controls both depression and anxiety. So the treatment should be directed towards both. And now what has happened is that once we are recognizing that 60% of the patients have dual diagnoses, there are drugs like Effexor or Lexapro. They alleviate both depression and anxiety. So now the clinicians are worried about or concerned about both diagnoses existing at the same time.
Why would somebody need to be put on an enhancement like Wellbutrin? What is the purpose of that?
Well, Wellbutrin is actually is an antidepressant, and also I have found out that in combination with Adderall, Wellbutrin works better. So it's like there is a synergy between these two medicines for the case of ADHD. Wellbutrin, again, all these medicines, all it depends on what suits you the best. Okay, so some people can take Wellbutrin, but if they cannot take it, you can start on other SSRI or maybe a small dose of anti-anxiety medicines like Ativan. So this is all depends on what suits you the best. But as I again said, that it has to be in combination with CBT and also talk therapy.
You have said that you yourself have been through anxiety and depression for most of your adult life, but that you also found that you were misdiagnosed. How did you decide, or what were the signs that made you say, I'm being misdiagnosed?
Because, the professional reasons or whatever, I went to about 6 or 7 psychiatrists. The two of them who were very clinically oriented or whatever, they said, yes, you are depressed and you are bipolar. But then I went to the two best psychiatrists in the country. And as a matter of fact, I had to go to the Cleveland, and he was a forensic psychiatrist. And he said, Dr. Benson, there is nothing wrong with you. Everything is fine. Then I went to the local one. He said the same thing. So then nothing was working. And then when I slowed down a little bit, then I said, I don't have much interest in other things. What normal people should have. So just about 3 years ago, when I was almost 73 years old, I diagnosed that I may have ADHD. And then I went to my personal physician. He said, no, you don't. You have been so creative and so this thing. But then I said, I want to go to a psychologist or a psychiatrist. And he did send me one. And he said, yes, you do. And that is the time people do not recognize that attention deficit hypersensitivity disorders can occur at any time, which is misdiagnosed. And I think I had it when I was 7, 8 years old, and it was misdiagnosed. And I can give you an example of Einstein. I mean, he is the classic case of having an ADHD. And then he was not diagnosed earlier. And now the people who are saying that if he were treated, he would not have been as creative as he was to come up with the relativity theory. So what I'm saying is, in my personal case, I have never been happier in my life since I was started on the medicine under the care of my family doctor. And that is where I'm coming from. That, there is a help for depression, for anxiety. You may call it a hopelessness, but it is not helpless. There is an help available, and all you have to do is seek the help, and help is there.
Dr. Bansal, thank you for sharing your personal story with us and also talking with us today about anxiety and depression. In the next podcast, we're going to talk about empathy and detachment. The book will be called Why and What to Do About It. And of course, the website is yourbetterhealth.life, yourbetterhealth.life.